Hello, everyone. Well, if you feel depressed, anxious, stressed out, or not yourself, you are not alone. More than 500 million people all over the world suffer from some sort of mental disorder. This number is probably much, much higher in today's day and time. Well, we are going to explore the evidence on how homeopathy can help with mental health. I am Amita from Nourish Talk, a platform for natural, holistic, and integrative therapies. I am super excited to introduce presenting this topic. We have Dr. Judyth Reichenberg. Dr. Judyth is a licensed naturopathic physician and board certified in homeopathic medicine. She has been in practice for over 35 years and is the author of 8 books. She is a researcher, homeopathic researcher of international repute, who specializes in treating adults and children with mental and emotional problems. Welcome, Dr. Judyth.
Thank you, Amita.
Great. So let's get started. Let's just start with how homeopathy has helped your clients.
Well, I am quite passionate about homeopathy. It made sense to me and I fell in love with it as soon as I read about homeopathy. And this was when I was in naturopathic school. I used to be a psychiatric social worker. I worked on a locked psychiatric ward in the emergency room. And I really was so discouraged and appalled by the sometimes permanent side effects of psychotropic medications. And I believed very strongly that there must be a more natural answer. And so that's really what I've devoted my life to. And over these 35 years, the more that I dare to say, the more that Big Pharma has become more widespread and that so many people are taking medications for everything, including mental and emotional problems, I feel stronger than ever that homeopathy is an excellent alternative for many people.
That's great. Should we move forward to the next slide?
Well, I can say that some of you who are listening know about homeopathy. Some of you don't know about homeopathy, but homeopathy treats the whole person. And so if you're looking, especially in this time of COVID, where we are isolated, we are bewildered, we are thwarted. My husband and I were supposed to go to Africa in September. There are so many things that are radically different. And if you feel anxious, like many people do now, if you feel like you're searching for your passion, like something you're longing to have life the way it was before, you don't feel yourself, then please consider homeopathy. And you can see on these slides, Mahatma Gandhi was quite an adherent of homeopathy. And to quote Paul McCartney, I can't manage without homeopathy. I never go anywhere without homeopathic remedies.
Yeah, homeopathy is actually used by the royal family in UK. That's what at least I have read in the newspaper, in the media. So let's talk about the alternative on homeopathy as well as different advantages and the cost advantage as well.
What we have said in some of our books is, what if you heard about a form of medicine that, and you can read all these different things, shouldn't that be front page news? And ironically, during this time of COVID, some of the more natural therapies are, for one reason or another, not front page headlines like I would like them to be. So homeopathy is a little over 200 years old. It is made completely from substances in nature, and those substances are prepared and diluted many, many times. It was founded by Samuel Hahnemann, a brilliant German doctor, and translated in Germany, a little over 200 years. One of the things that's so astounding that you may not even be able to believe, there's over 5,000 homeopathic medicines, 5,000, and more proved as time goes on. You constitutionally, or for your ongoing longstanding symptoms, need one of those 5,000 medicines or remedies. And that's the art of homeopathy. And that's something you couldn't find on your own. If you wanted to treat yourself for a bruise or acute diarrhea or anything that is just an acute symptom, you can do that, and you can do that effectively, but not for your chronic symptoms. It's quite complex. Homeopathy is safe. It's safe for babies, for pregnant moms, for seniors, for people who are highly sensitive, who have compromised immune systems, who are on other medications, such as psychiatric medications, anti-anxiety medications. So it has, it's really quite astounding. And I think if more people knew about homeopathy, understood it, they would be chomping at the bit. And I think it's interesting for me because during this time of COVID, I have more people calling me than ever. So it is a time when people are looking for alternatives. And if you have a chronic problem, more than something you've had for 2-3 months, you really need to find a professional to help you, because how in the world are you going to find that one in 5,000 remedies?
That's very, very true. So let's move on. I think our viewers would love to hear from your experience, some few of the success stories that you could share. So we'll just move on to one of them.
Yes, this was a really tragic case. This was a woman who, you know, a very intelligent, very, woman who was happily married and who was quite effective in her life, except that she was in another part of her house when her 2-year-old fell into their swimming pool and drowned. So it was truly devastating. And it was one of those life events that can take you down a road of despair for life. And you can see she loved to entertain, she loved to cook, but there was a marked difference after her daughter died. She became really obsessive. She started washing her hands. She felt that she couldn't get clean enough. And she developed acne, rosacea, eruptions on her face. Her hair started falling out. And she was suicidal. She was in profound despair. And there is a homeopathic remedy for this picture. It's made from a mineral, potassium bromate, calibromatum. And it is a remedy for people who feel that they need to be punished. They feel horribly responsible for not having been able to save someone or something similar. And so that's what I gave her, calibromatum. And any homeopath who heard this story should be able to recognize this remedy. So it is not an obscure remedy like some are.
And you mentioned that she had taken some medication as well. She was on medication when she approached you,
yeah, she was on medication, and you do not have to stop your medication in order for homeopathy to work. But she did consult with her psychiatrist. She did discontinue the Zoloft, which she and her psychiatrist didn't feel was working. And she needed, over the next 1.5 years, 4 doses of the calibromatum. What this means is there are different ways to prescribe homeopathic remedies. And at the time that I treated her, I was just giving 1 dose at a time. All you need to do is really stimulate or reprogram your vital force. And once that happens, there will be a series of events that balance you as a person. And so she only needed, we're talking about 4 single doses of the calibromatum. And she improved all around, which is what does happen with homeopathy. Not just her mental state, but her acne, her hair loss. Her concerns became much more reasonable. I'm sorry that I have son here instead of daughter, because I often try to disguise the case,
Sure.
you know. And she did not need to resume the Zoloft. And this, a lot of my patients I see for years. I have patients I've seen for over 30 years. Just, you know, I see them a few times a year or periodically. But wasn't necessary for her. She was able to move on. And then she told me later, we just went through a really hard anniversary. Of course, many partnerships, marriages, where they lose a child, end in divorce. But that didn't happen while I was seeing her. She said, my depression and suicidal feelings have been in check. I'm much less obsessive, and I can finally talk about the accident. And I've not had feelings of not wanting to be here. So that's a beautiful case, and that is quite typical of what can happen with homeopathic care.
And how much time did it take her to get well? You said over the next year and a half. Was that?
No, but we have 6-week follow-ups.
Oh,
and
I
so
see.
At that 6-week point, it was clear that the remedy was working.
Within 6 weeks.
At the 6-week point. And then what I mean when I say 4 doses, what I mean by that over the next year and a half is at the 6-week point, she was doing well. So there was a choice point at that time. Either I repeat the remedy or I wait. And as long as she was doing really well, I waited. And what that means is over the next 18 months, there were 3 more times where she said, I think I could use more of the remedy, where she was sliding somewhat. And then that was repeated. And then I didn't see her again.
That's actually a very beautiful but a sad story to begin with. But in the end, at least the mom was able to cope up with her loss, which is unbearable for any mom. But still, she was able to move on. Is very touching.
And I could have just as easily given her a low potency every day in addition of the same remedy. I didn't. I wasn't doing that at that point. But the whole point is there's a resonance. There's what's called the simillimum, which is exactly the right remedy. And if you find that remedy, there will be a profound change.
Okay, let's move on to another case, which is a little bit different of bipolar disorder. So this
is a person, I haven't treated him lately, but I did for a long time. And I have treated his daughter who inherited that tendency to bipolar disorder. I'm still treating her, and I've treated her for, 15 years, maybe longer. And she's doing really well on a totally different remedy. So this person was a total character. And I still see him periodically in passing. And oh my gosh, larger than life. He complained of a general sense of unhappiness and undercurrent of melancholy. And he was what you could call a pretty flaming or raging bipolar. He was up and down and just very intense overall. He said, I have episodes of being gripped by anxiety, being on the verge of tears, but they pass quickly. I cycle rapidly between hypomania and lower levels of agitation. I rarely feel enthusiastic, although if you met him, very intense guy. I've been dealing with bipolar disorder and alcoholism for many years. You helped my daughter, now it's my turn. He had insomnia, especially in the winter, and he labeled it as seasonal affective disorder. Some people call it monkey mind. I call it squirrel cage. In other words, his mind, his thoughts were really all over the map. If I could address these issues with homeopathy, I would be a happy camper. He had been on all kinds of medications without being particularly effective in helping him. He had had lots and lots of counseling and was really a very go for it kind of man. He had had head injuries, on the job accidents. He was hit in the side of the head with a steel beam. His remedy was very different, although it turns out that both of these cases that we've included needed mineral remedies. Now, as I mentioned, there's over 5,000 remedies. So many of my patients need remedies from the plant kingdom or from the animal kingdom. But these two cases just happen to need mineral remedies. And if you think of the qualities of iron, just think, if you knew nothing about homeopathy, what you might think of. A will of iron, tough as iron. In other words, just you think of that metal quality, and you might think of iron in battle. Well, that is some of what you see in the picture of ferrometallicum, or iron. I treated him for a number of years, and then he felt like he didn't need to do it anymore, didn't want to do it. But I still see him because I still see him periodically, just in passing, and he's still doing well. And he said, I feel much more at ease, balanced, less jumpy, and I've noticed a marked improvement. And again, this is a summary of what he told me over years. But believe me, if he were really in bad shape, I would know immediately, because his wife would put me in touch with him.
Okay. So these are the results and outcomes. You talked about this earlier.
Yeah, so I treated him for 9 years, and then he decided he didn't need homeopathy anymore. So this is remarkable. Over 9 years, he did not have a single hospitalization for bipolar disorder, nor a close call. That didn't say he had no ups and downs. He had blips where he fell into his drinking, but each time it was manageable. And at this point, when I wrote this, which was some time ago, I was seeing him every 6 months. And since then, he has not felt that to be necessary. So this is a good example with patients with bipolar disorder. You may or may not be able to get off the medication, but that in this bipolar disorder is not the most important. I'm talking about your conventional medication as well. What's most important is that you're going pretty smoothly in your life, that you're functional, that you're happy, that your ups and downs are minimal. So I don't assure patients who are on psychiatric medications, yes, of course we can get you off. Many times I can, but not necessarily, and that's not my goal. And so I'm thinking right now of 2 patients I've treated very long-term. We're talking about decades, who have bipolar disorder, and no hospitalizations, at least 15 years. One of them I've treated 25 years. And no or very limited hospitalizations, being able to have a job and being able to function. And it's very gratifying.
It surely is. So let's just talk a little bit about how does a homeopath know what you need and how does it work? You talked a little bit about more than 5,000 medicines earlier.
That is the art. And it's called case taking. One of my homeopathic teachers calls it case receiving. So when I wrote this slide there, I said there are over 3,500 substances. Now there's over 5,000 and growing. But for each person, there is one particular substance. And Samuel Hahnemann, the founder of homeopathy, called it the simillimum, or the closest match. And That is what we're looking for. And it's not always easy to find, but we do that through an interview. And so it's a 90-minute initial case taking. And during that time, I listen and I really try to understand the core of that person, the nature of that person. And it can really be what that person has been like since the beginning of his or her life. And certainly I treat a lot of kids, but that's why we call it the totality. And so the idea is like cures like, the same substance in nature in a crude form, which can cause a set of symptoms by taking it again and again and again. If it's prepared homeopathically, prescribed correctly, taken correctly, can cure those same symptoms. So one thing about homeopathy, I can remember I was interviewed once and somebody said, "What's new?" Well, it's true that there are things that are new. The sensation method, I didn't start practicing at the beginning, but also what's important is the tried and true aspects of homeopathy. And that's why much of the homeopathic literature is still really useful after over 200 years. So any substance from nature can be used as a homeopathic medicine. We're talking about flowers, the most common are calendula and arnica acutely. We're talking about animals. I recently had a patient who needed boa. I have a patient who needs butterfly. I had a child who the first sound out of his mouth was a roar, and he needed lacleoninum, which is lion's milk. So it can be an animal, it can be any plant, it can be something from the mineral kingdom as simple as natrium muriaticum, which is salt. So that's the key, to find what remedy you need. And for chronic problems, you're not going to be able to find it yourself.
Okay. So what should one expect from homeopathic care? You mentioned about the 90-minute of case taking earlier.
It's pretty typical among homeopaths to have an hour and a half for that first case taking. And those times when I feel like I don't quite get it, either I don't know what to prescribe, or there's just something missing as far as how the case hangs together, I will spend more time afterwards with that person. And of course, I don't charge for that. But I need to have a level of confidence to prescribe homeopathic remedies, a high level of confidence. One thing that distresses me is on Facebook, for example, there are groups that I rarely respond to, but they're asking, individual homeopaths are asking, what do you think I should prescribe for this case or that case? And I find it quite upsetting, and I have to contain myself to not respond. What are you doing asking publicly what to prescribe for this person? Because if you don't know what to prescribe, you should not be treating that person. And so, sorry for the rant, but so what we're talking about is a single, and this isn't necessarily a single dose, but we're finding a single homeopathic remedy for that person. It's much less important, the potency and how it's given, whether it's pellets, whether it's a liquid. What's most important is that it's the right remedy. And you will feel a difference within days to weeks. So at that 6-week point, it's very rare that I can't tell whether the remedy is working or not. And really what we're talking about is any symptom that can improve will improve. If you've had surgery and something has been removed, well, we can't replace that, but we can help you with the scar tissue, for example. What's happened since the surgery. But we're talking about mind, body, emotions. All of those should be improved with homeopathy, not just 1 or 2 symptoms. And energy. as well. Attitude.
Excuse
Yes.
Excuse me, I'm sorry. I don't know what happened. Please go on.
So the follow-ups, and again, what I do as far as follow-ups, and I treat a lot of people internationally and by video. I'm not comfortable going into my office at this point, and neither are my patients. So now it's all by video. So the follow-ups are every 6 weeks initially. This is very typical of homeopaths, not just me. And then as the person's doing better, they extend to every 2 months. And then I have patients who I see very infrequently, but they know to contact me. And a lot of people just contact me by email, and then we set up a tele appointment. They know that if anything is going on with them, they can just contact me. This is really important. There are some homeopaths who are not very available. And especially in the time of COVID, that can't happen. You really need to be available for patients. So as far as, if we're talking about anxiety, as far as tapering off any prescription medications, that's something to consult with the prescribing doctor. Hopefully, if the patient is doing well, I would hope that the psychiatrist would be thrilled and would be happy to decrease the medication. Although it's too much to expect of most psychiatrists for them to understand how homeopathy works. There are exceptions, and that's great. Some patients need to continue to take their medication along with homeopathy. One of the patients that I mentioned with bipolar disorder, I've treated her for at least 25 years. And she does need to continue to take her other medication. And it's fine because she functions in a highly professional job. She's gone through some serious relationship crises, and she's doing very well. And she doesn't, I don't talk to her that often. I talk to her really once every few months. But, you know, we've worked together for so long, we have a telepathic connection. And so if she comes into my mind, I write her and I say, "Are you okay?" And invariably she will say, I was just thinking of you. I was just about to call for an appointment." But she knows I'm there, and that's really, really important. And my longest patients I've treated for 35 years. And some of them I am still treating. Some of them like to still talk to me every 6 weeks. With some of them, it's much less frequent. But those patients who are really committed to homeopathy often do so for life.
That's beautiful. Apologies, I don't know what happened in my throat earlier. Suddenly I was, so give us your tips to your happy and healthy life for our viewers.
Okay, I'd be happy to do this. So as we've seen with COVID, it's not just one thing, you know, there are components that are really, really important. These are all so relevant at this present time. We can thank Ram Dass, who recently passed, for that famous expression, "Be here now." But the idea of when will the quarantine end? When can I go back to life? When my normal life? When can I start traveling again? Where can we be except in the present and trying to go breathe fresh air, eat healthily, take homeopathy and or other supplements, communicate with those you love. So be here now, more important than ever. So one thing happens with people who have mental and emotional problems. They can be very hard on themselves. They can, you know, and really all we can do is be the best we can. You know, we've been given these divine qualities. We've been given skills and intelligence and common sense. And all we can do is the best we can. and then to let go. Don't sweat the small stuff. Again, that's not an original quote, but really focus on what matters. And right now it's on relationships and on keeping ourselves healthy, on maintaining our relationships, even if we can't be with those people personally, on being careful and knowing this will all pass and change. Everything changes, and there are some bright lights, such as the decrease in pollution, such as what's happening with the animals and nature. Laugh and smile. I've always admired those people who walk around everywhere, or whenever you see them online, they are smiling. That is an art. Being kind and generous. This is a very challenging time in the world and in the US. And one of the things that I cannot help but comment on is what I see as heartlessness. And every time we see people who are treated less than heartfully, whether they're children in cages, whether they're people who are beaten on the streets, whether there are people who are terribly insulted, what can we do? We can be kind, generous, loving, and if we have the resources, help in whatever way, financially or otherwise. Keep good company, whether it is by Zoom and whether those people are 7,000 miles away. My husband and I live half-time in Chile, right at the foot of a beautiful volcano and overlooking an amazing lake. And yesterday I spent an hour talking to the person who caretakes our land. And it gave me really such comfort to reach out to him and to share. So really, it doesn't matter where people are. I'm participating in a webinar that's happening on the East Coast this weekend. And there are about 150 of them all over the world who are chanting and who are singing and who are virtually holding hands together. That's what we can be doing. Cultivating an active gratitude, an attitude of gratitude. We just lost our 13-and-a-half-year-old golden retriever a week ago tomorrow. And she died here at home of cancer. And it was really rough. Dulce de leche. But there are many, many things to be grateful for. The air that we breathe, the food that we eat, the people we have to love. And remember, not everyone has that. There are people who don't even have enough food right now. There are people who are profoundly alone. There are people who are struggling for their lives in a hospital or otherwise. So how fortunate we are. Forgive and forget, just to remember what is most important. And the small details and grudges, believe me, when COVID ends and we're able to move on, those are not important. Take good care of your body, eating healthy, organic, fresh food, drinking pure water. Where I am, it's summer and it's beautiful, and be out in the sun whenever you can and move, exercise, breathe. So I've grown a garden for, I don't know, nearly 40 years. So an organic garden. So for me, that and being out in nature and hiking and walking on the beach are an essential part of what I love about my life. And for me, not having a pet, I can't imagine it. We still have our 12-and-a-half-year-old golden retriever Oso. In Chile, we have a whole menagerie. We have an enormous Great Pyrenees puppy who I just bought him a swimming pool that we're going to take down. And cats who sleep on our bed, and sheep and chickens and ducks. Not everybody can have that, but really feed your heart, feed your soul. And I heartily recommend gardening.
Beautiful. It's such a beautiful, beautiful talk. I hope our viewers are listening and acting on some of the suggestions that you've given us. I would like to open it up for questions now. And I see from the participants, any questions on any issues or anything that you'd like to discuss or ask Dr. Judyth. She is here with us live from Washington. People are thinking of questions.
Yeah, I'm happy to answer anything that I can.
Absolutely. One of the questions that has been brought up is, like you said earlier, is finding the single homeopathic medicine. So let's say from any of your clients' point of view, the things change over time, then does that, like, you would also change the medication accordingly after some time, or how does that whole process work? Because I've been just reading some case studies and people say, oh, I started my patient with one, and then after 2 months I had to change something, and then 3 months. How does that whole process works? For our viewers, I think it'll be helpful to learn.
Well, once you know that the homeopathic remedy is the right one, and so that is usually obvious after 6 weeks, the person will feel better all around. Then you do not change the remedy.
I see.
So either you wait, or you repeat it, or they're taking it on a daily basis. There's many ways to prescribe. I have many patients who have been on the same remedy for years. However, if the picture changes, then the remedy can change. But this is classical homeopathy, one remedy at a time. So I'm not giving people multiple remedies. They can use an acute remedy. You know, in other words, if they have a severe burn, even though they're on a constitutional remedy, they may need cantharis, they may need urticurins, they may need something like that. But the constitutional remedy often is the same. There are changes in life picture, etc., but I find a lot of times it may or may not be quick for me to find the remedy. It depends. But I definitely have patients who for years have been on the same remedy. But I'm open. And if something shifts, I had a patient yesterday who's on a remedy, and she's doing well on that remedy. And she called me because she thought maybe she had COVID-19. And so we went over all of her symptoms, and the way she described how she felt fit the constitutional picture. So that is what I felt she needed, rather than an acute homeopathic remedy for COVID. Though I send out a newsletter to my patients periodically about COVID, and it covers the waterfront as far as homeopathy, as far as nutrition, as far as immune support. All of those are really, really important now more than ever. But you do not want to frequently change remedies unless it's the wrong remedy. If that's happening to you, something's off, and someone's not understanding you or prescribing correctly.
Okay, so now, I mean, today's in COVID times, all of us are feeling a little bit anxious. Is there anything that you think a normal person can buy off the shelf, any homeopathic medicine, or you think the proper consultation should be done, even if you're feeling a little bit anxious or a little stressed or something?
Well, I guess I could say two things. For one thing, you can't go wrong with rescue remedy. And so rescue remedy is their Bach flower remedies. And so it's not the same level of depth as homeopathy, but that's something that you can feel free to take, and that might help. As far as our book, Homeopathic Self-Care, The Quick and Easy Guide for the Whole Family, has 70 conditions. And that is something that you can look under anxiety and see just acutely if there's a remedy that fits. But I don't believe in self-prescribing for anxiety, if it's a chronic condition, or you know, if you need the help of a homeopath, I would do that. I see that my friend from Chile just raised her hand. Maybe we can address her question. Lydia, hi.
Well, they can't talk.
But
So,
can she? But can she? She raised her hand.
She has to type it up. Any questions, please, of all the participants? Please type it up in chat or in Q&A. Yeah, that's how the questions and answers work. This is a webinar. They can be anonymous and they can ask questions, but please type it up in chat and in Q&A. So I think the self-care book I think what we will do is we would send it out to all the participants. The self-care, your ebook is what you're saying, so that people at least some idea.
It comes as an ebook, and that would be great if you could do that. And it also comes in two other forms. It comes in a hardcover, and there's an optional kit. And we, about 4 years ago, there's another book, you can't see it now, but it's a smaller version. And it's called The Savvy Traveler's Guide to Homeopathy and Natural Medicine, What You Need to Know to Stay Healthy Wherever You Go. So that's a little one, and you should have an ebook of that too, that you can tuck into your pack or your suitcase and treat yourself. But the homeopathic self-care, that book has sold over, I forget, 25,000, 30,000 copies. People have raised their children on that book.
That's unbelievable. That's amazing, amazing. So there's a question on how much potency do homeopathic lose if you take them near meal times?
I question whether that it really matters. We always tell our people to tell our patients to take it at least 5 minutes away from eating or drinking. There's a story years ago about a woman who needed arsenicum for anxiety. This is decades ago. And she misunderstood the directions, and she put it in her bathtub instead of taking it orally. And it worked. So I think what's absolutely most important is to get the right remedy rather than how you take it.
Someone is asking where to buy your books. They can buy on Amazon, or we can send them a link if it's not on Amazon, or
any of those are possible.
Okay. Yeah, we can also send you links, and you can reach us. I don't have our email here, but you can reach us at care@nourishtalk.com. Let us know your feedback, please, on the sessions. And if you need to get hold of Dr. Judyth, we'll be happy to put you in touch with her as well.
I do want to just say that just be aware that the ebooks are very short kind of synopses, and they're not the same as the whole book. And I do want to just say I treat people from all over the world, by Skype, and so I'm please contact me if I can be of help to you or your children. This is a very specific topic, but I treat patients, a lot of kids, and for ADD and actually, Amita, hopefully we can do another webinar in the future that will cover some of the other things like kids.
Absolutely. I think autism is a big topic, and how homeopathy has had a lot of success with autism, ADHD, like you said earlier, anxiety, mental health is just our need of the hour in today's day and age. So we felt that, right, both of us felt that this would be more appropriate. All of us are going through some sort of anxiety, not necessarily a disorder, but some sort of anxiety. Okay, any other comments or questions from the audience before we decide to wrap up? I just want to give a moment. I think I feel that it's a beautiful talk, Dr. Judyth. A lot of wisdom. You must have treated like thousands of patients over the years, and for mental health, I can't even say.
who knows how many, thousands and thousands. I'm sure it's true. but I love it. You know, here I am. I am 72, although you may not realize that. I've been in practice for 36 years. We still, you know, live on 2 continents and have very vital lifestyles. And so I have no plans to retire from.
Oh my God. You are my role model. You look amazing, amazing. I would have never guessed your age.
I know.
That's amazing. So you continue to work and serve the community and spreading the word of homeopathy for more people.
I do want to say that, you know, you can check this out online, but homeopathy has been at risk. You know, the FDA has said that they might even eliminate homeopathic remedies, and you know, with the current climate, etc., it has not happened, and I hope and pray that it doesn't. But if you maybe what I can do is send you a Meta link, because it is really important that you spread the word to save homeopathy in the US.
Okay. With that thought, we would like to wrap up. If there are no more questions or comments, I want to thank Dr. Judyth for coming on for this session. To our viewers for watching us, please let us know your feedback. You can reach us on Facebook. You can reach us on our website, on our emails. There are a lot of different ways. Before I wrap up, any final comment from you, Dr. Judyth?
No, I guess they can find out from you how to reach me.
Yes.
Just stay safe, stay healthy, and it's a beautiful world. And we may not understand why this is all happening, but I do trust in divine wisdom. And let's stick together, stay positive, and heal.
That's a really, really beautiful thought. Thank you so much. Yes, everyone else, try to stay safe and try to get outdoors on the weekend. And signing off now. Thank you so much. Bye-bye.
Bye.